Past the age of 50, our muscle strength naturally begins to decline. A simple, everyday motion, like lifting a heavy moving box, can suddenly become the tipping point that causes a mechanical failure in the body. This diagram shows exactly what that failure looks like. Internal organs or tissue push through a newly formed weakness in your abdominal wall, creating a visible physical bulge known as a hernia. Repairing this mechanical gap always requires surgery, and in the UK in 2026, getting that surgery means choosing between two very different currencies, your time or your money. If you go through the NHS, the repair is completely free, but you will face a waiting list, often up to half a year, where you must live with the discomfort and modify your daily life. If you choose a private clinic, you can have the operation done in a matter of weeks. The trade-off is the out-of-pocket cost, which currently ranges from £2,400 to £4,400. Before you weigh those two options, there is one critical medical exception that bypasses every waiting list and private consultation. If the hernia turns dark purple or black, or if you experience sudden severe pain and vomiting, the tissue has become trapped and strangulated, you must head straight to an NHS A&E for immediate, free emergency surgery. Unless you see those emergency markers, you have the breathing room to treat this as a logistical decision, a matter of weighing your budget against your daily activity levels. To figure out exactly how much a private repair will cost, or how long your NHS wait will be, you first need to know exactly what kind of hernia you have. The most common type is the inguinal, or groin hernia. It accounts for 75% of all cases and predominantly affects men. This table breaks down the current data. For an inguinal repair, the NHS wait is between 12 and 18 weeks. Privately, it is the least expensive option to fix, typically costing between £2,400 and £3,200. Then there is the umbilical hernia, which occurs near the navel and is more common in women and overweight individuals. The NHS wait here is slightly shorter, at 8 to 14 weeks. If you go private, the price starts slightly higher, ranging from £2,500 to £3,400. If you have had previous abdominal operations, you might develop an incisional hernia along the old surgical scar lines. These are highly complex to repair. Because of that complexity, the NHS wait stretches out to 14 to 24 weeks. It also carries the highest private price tag, maxing out around £4,400. There are also hiatal hernias affecting the stomach and femoral hernias in the upper thigh, the latter carrying a much higher risk of strangulation. Knowing your exact diagnosis is the mandatory first step. Without it, you cannot accurately set your budget or predict your timeline. The second variable that controls your private bill is the specific surgical technique the doctor uses to patch the muscle. Standard open surgery uses a single 3 to 6 centimeter incision to place a supportive mesh directly over the weakness. This method sets the baseline price for private quotes, but the trade-off is a restrictive physical recovery period that takes 4 to 6 weeks. Alternatively, you can opt for laparoscopic or keyhole surgery. This is a less invasive upgrade that utilizes 3 or 4 tiny incisions. Looking at this cost to recovery chart, you can see the impact. Keyhole surgery cuts your recovery time down to just 1 to 2 weeks. However, it will add a £200 to £400 premium to your final private bill. Some select private hospitals also offer highly precise robotic repairs, though the availability is limited. Paying that £400 keyhole premium secures smaller scars, yes, but practically it buys you back a full month of active life. The final factor in your private quote is geography. Where you have the surgery heavily influences what you pay. Major medical hubs charge a premium. At the Cromwell Hospital in London, complex repairs can cost upward of £3,800. This map highlights the regional contrast. If you look at smaller regional hospitals in places like Manchester or Leeds, you can often find the exact same standard of care for under £3,000. Traveling for surgery does require careful planning. Sitting on a train or in a car for several hours during your first week of recovery will be uncomfortable. But if you are willing to manage the logistics, taking a 2-hour train ride out of the capital can easily save you £800 on the exact same procedure. By combining your hernia type, your preferred surgical method, and your location, we can map out the most logical path forward. Consider our first profile, the budget-conscious waiter. If you have a stable, low-pain inguinal or umbilical hernia and you cannot justify pulling £3,000 from your savings, the NHS route is your best choice. The real cost here is discipline. You will have to commit to strict lifestyle modifications, like avoiding any heavy lifting, for the 3 to 6 months you spend on the waiting list. Our next profile is the time-poor optimizer. If you are highly active, still working, and the hernia is aggressively degrading your daily routine, the private laparoscopic route makes sense. You are sacrificing around 3,000 pounds to bypass a 5-month wait and compress for surgical recovery down to just 14 days. Finally, we have the high-risk monitor profile. This applies if you have a higher-risk femoral hernia, or if you are dealing with pain that is escalating and unpredictable. If your symptoms spike, abandon any plans for private consultations and go immediately to an NHS A&E. Your next step is straightforward. Consult your GP to confirm exactly what type of hernia you are dealing with. From there, you can assess your finances and confidently choose the path that protects your lifestyle past 50.